But I have three main learning objectives. So first, I want you to attempt to be mindfully present and engage in today's presentation. So close those laptops, don't be checking work email, don't be scrolling or shopping. Invest in yourself and enjoy this presentation. And it will be very brief because of some of the other objectives. Second, I'm going to have you learn about whole person health modalities to help address stress. Not only are we going to do aromatherapy, but we're going to give you other options that may fit for you. And then lastly, we're going to participate in creating your own aromatherapy products. So before we get started, I want to talk about terminology to make sure we're all on the same page. So you may have heard the term alternative therapies, right? So these are using therapies instead of the conventional Western medicine. You may have also heard of complementary therapies. As the word implies, we complement our conventional care. And for decades, we used the term complementary and alternative medicine, or CAM, which is the use of non-mainstream approaches in addition to conventional medicine, right? You've heard of that? Show of hands, maybe, okay. In the last 15 years or so, we use the term integrative health and medicine, which is using complementary approaches and incorporating providers in those decisions. But most recently, we're moving into the whole person health. This is kind of giving you a whole time frame. And you will see more of this in the literature, and this is really in place to help with reimbursement services for these therapies. So what is whole person health? Two components. First, we want to evaluate the whole person. That's the word defines, the mind, body, and spirit. But we also want to look at other factors like biological, behavioral, social, and environmental that either promote health or, unfortunately, sometimes disease. But not only do we help and empower the patient, we now want to bring in families, communities, and the population to help restore health, promote resilience, and prevent disease across the whole lifespan, from birth to death. Okay, so stress. Here's a nice wordle of all the things we think about when we're stressed. So let's see a show of hands. Gosh, let me make a small time frame. What about in the last week? Who has experienced some stress? Raise your hands. Wow, almost everybody, right? I get it. Like, what if many of you came from far and went through the airport and TSA? Or maybe you decided, I'm not that far, I could drive in, or even drive in this morning and I have some road rage because the way these crazy people in Colorado drive. Or maybe you just have family members, friends, work calling you, just like, hey, I'm out, I'm developing, don't bother me. Add some stress, right? Well, interestingly, the literature states that 75 to 90% of visits to providers is due to stress. That may not be why you're coming in, right? Your blood pressure, cholesterol, hormone issues, whatnot. But underlying, there's stress there that could be impacting that. So no surprise, the raise of hands pretty much reflect this. That's why we're doing this talk. And I thank Judy for the organization investing in you guys as members and having a talk to decrease stress, because it's very prevalent. So let me just not pretend you guys are all stressed. Are others stressed? So if we look at our professionals, those that take care of us, physicians, 54% of them are stressed out, have at least one symptom of burnout. And this is a bigger deal if they see patients in the emergency room, family medicine, internal medicine, or OBGYN. It really is quite, the masses. There are specialists as well. And more females than males. Okay, so those are our physicians, MDs and DOs. Nurses, right, providing supportive care. 50% of them are emotionally exhausted, and more if they work in a nursing home, direct patient care, or the hospital. The data shows that 2 out of 3 nurses have a hard time sleeping, and 1 out of 4 are clinically depressed. Yikes. And they're there to help you if you are needing care. But it's a pharmacy conference. What about pharmacists? 53% feel burned out. Now that data might be kind of wrong when I'm talking about our Colorado Pharmacists Association, and those numbers, it's probably higher. But that's where I found kind of similar information. You're like, I don't care, I'm a technician, right? Yeah. 91.6% of you guys are burned out. Holy moly's, right? Why? And somebody throw out, let's make this informal. Why would you guys be burned out? Imbalance, staffing, overworked, taking care of the patients correctly. Yep. Nurse. Those 50%, that is our auxiliary, right? That help us, you're right. So definitely literature states staffing, unrealistic expectations, some of these crazy things like quotas, underpaid, and others. So it's a big deal, right? However, it also notes that employers, how come you're not providing your legally required breaks, allowing your technicians to take a break, recharge, and come back? 44% of you are having a problem with this. And I don't care if you're in healthcare or not, right? I had a kid working in the movie theater. He's like, oh, I haven't had a break all day. I'm starving. Yeah, that's tough, definitely. 56% of you feel it's affecting patient safety or stress. That's a big problem. However, I'm pleased to see that the same 91.6% still have passion for their work, which is probably why you're here and learning and networking and really growing. I don't have any information about physician assistants, but it's pretty much similar to what you see here. Okay, so when we're stressed, what happens? We have the fight, flight, or freeze response. And I'm not going to get all technical because that's boring and that's the teacher in me. So if you are in a stressful situation, you may fight. You may react to what's going on. Or you may flight, like, you know, I'm just leaving from here and I'm going to the garage. It's a little late. There's some person following me that I don't know. I'm a little uncomfortable. I'm out of there. Or I have all this skill set and I panic and freeze. So any of these three things can happen when you're stressed out. Now, stress is interesting because it can be that external piece, like the garage situation. It could be almost getting in a near-miss accident and all the emotions that happen when you didn't wreck. But it's also what goes on up here. I don't know, you know, we're in the summertime, but as holidays come up and we start spending time with maybe in-laws, you're like, okay, so we're going to have a holiday. There's going to be some conflict. They're going to want to talk about religion and politics. Oh my, I'm already stressed, right? And it hasn't even happened yet. So there's many ways we can be stressed out. But overall, our body's really smart and can deal with this for a short period of time. It has a lot of mechanisms, but it does stay on high alert to the what if. What if I have this situation and how am I going to deal with that? So that could be a problem. So there are a lot of hormones in our body, but we're going to focus on two in particular in regard to the stress response system. First is cortisol. Cortisol is considered the stress hormone. It's produced in the adrenal gland, which is found on the back right above our kidneys, and it breaks down protein and converts to energy and fuel. Why? If you're in that stress response, you can fight. Your muscles will know what to do and you can move on. It also can worsen your immune system. So if you kind of notice when you're really stressed a lot, you're always sick. Yeah, your body's like, I'm overworked. I don't know where I want to, what do I want to tackle first? And unfortunately, when you have an event and you release this cortisol, it hangs out in the body for about 14 hours. That drive-in just screwed your day, right? Or your kid trying to getting on your nerves, trying to get out the door, get on time. I mean, any little stressful thing, whatever that might be for you, can really impact your body all day. Now, other side of the coin, DHEA. This is also produced by the same adrenal glands. It does some good things, reduces cholesterol, it builds your immunity system, so you have less risk of colds, and it does a lot of cellular maintenance, repair, and regeneration. It's considered the vitality hormone. So when people say, well, what's the fountain of youth? Figure out how to deal with cortisol. That's really what you need to do. So cortisol is bad, and DHEA is good, excellent. However, you don't just have one or the other. You actually have both of those going around all the time. So we want to look at the ratio of how much bad cortisol and good DHEA we have. If we have too much, we see accelerated aging, impaired immune response, increased fat in the waist and hips, so that increases our risk for the metabolic syndrome. Our blood sugars go up. We are at risk for obesity, diabetes, and heart disease. So a big deal, right? For maybe our traditional practitioners saying, ooh, there's a lot of downstream problems. We need to manage this. So what can we do? There are a lot of options. Direct to consumer, which only exists in the United States and New Zealand, will tell you there's all kinds of stuff you could do. Well, there isn't evidence it all works. So we're going to talk about a handful of them that do. And so here I included kind of a picture of some of those other whole person health modalities, okay? So different treatment options, and it's there just for completeness, but it is not all inclusive. That's kind of where we have a lot of research. But for stress, we could do a couple things. We could have a work-life balance. We could do wellness and self-care practices. We could tackle that gray and yellow physical and psychological modalities. So things like yoga. Wait, is that happening? When is that happening? Sign up. Sounds great. Tai Chi, Reiki, healing touch, dance, art therapy, acupuncture, acupressure. You have heard of some of these? Maybe participated or will participate in some yoga? I have no stock in them, so it's really great that this is happening during this conference. And they're doing oil, so I got to call them up. All right, so you can also do mindful breathing and meditation. You can take some dietary supplements that might help. And then, of course, aromatherapy. Okay, so let's talk through each of these briefly. So wellness and self-care. So Peggy Schwarber created the 8 dimensions of wellness, and it circles around emotion, spiritual, intellectual, physical, environmental, financial, occupational, and social. If one or more of these areas are in disbalance, you're going to have some increased stress and illness. Now, looking at that and all those hands that said I was stressed, sure it's hitting one of these, if not more than one, right? So if one is or more disbalanced, you're going to have illness. So really, we need to address all those components. Now, you may say, well, what exactly is wellness? Well, wellness is how you see yourself and how your life is. So it's different for each person. So let's get through some examples. How could we tackle some of those bullets? We could connect in the environment. Go outside, take a walk, have your lunch outside. Include plants in your space, so that fresh greenery, that's that forest bathing that occurs. Listen to white noise of nature. Now, please don't do the sound of sleep, while you're working. That might not be helpful. But other noises that make you feel you're connected to the outside. Nurturing, professional organization. Look at the next bullet point, volunteer. Dimitri, right? Volunteer, there you go. And also reach out to family and friends, have that connection. Some of you may be the other brain, say, I like to draw, sketch, paint, craft, maybe write a story, poem, or songs. Buddhist medicine, a nutritional meal is very helpful as well. Some like to journal. Rest and relaxation, listening to relaxation music, physical activity, taking a nap, meditation, mindful breathing. So we have these resilience coping skills that can kind of help. So mindfulness, there's so many apps, right, on our watches, on our phones, those subscriptions that can help us be mindful. Gratitude, what's going well? What do you enjoy? Who do you appreciate? Let people know, right? It's kind of a mean world. Let people know good things. Love your outfit. What a great haircut. Let them know, because it's just not enough. Also look at self-compassion. Give yourself some damn grace. It's okay. Not everything's going to be perfect. Do your best. Tomorrow's another day. And then lastly, growth mindset. What's going well? What do you need to work on? What do you want to improve? Okay, so I want to ask at the check-in, did everybody get a little baggie from Dimitri? If not, raise your hand. And maybe okay. So Dimitri, do you mind handing out who is ever missing? Okay, great. So now you're able to open your bag, and I want you to pull out your acupressure ring. For those of you online in my Zoomy land, you received a link of where you can purchase these on Amazon. It is one of the most affordable items, and it comes in more than one. So when one breaks or you have a friend, you can share. So I hope that you guys might have purchased those prior. So acupressure and puncture is a method to help with stress. I've included these acupressure finger rings of different colors. So I mean, swap bags with your neighbor if you want. I mean, they're all the same. And what you do is that you take your ring and you insert it on your finger digits, on all 10 digits. You can leave your rings on if you want. You could take them off and slowly and surely move them up and down those fingers. Woo. There are pressure points on your fingers that tackle different parts of your body. And so if you really look at finger rings, they are kind of the new age fidget spinner. So people that do a lot of artwork, play guitar, music, hold back, use a computer, so that's probably everybody here, may have some of these stress points on these fingers. Now, I'm not an acupuncturist or pressurist. I don't have traditional Chinese medicine practice, but this will really tackle different areas on the finger in different areas of the body. So you guys keep playing with it throughout the talk. Show of hands, who's like, I love this. This is like a massage for my fingers, right? Pretty cool. Who's like, oh God, it's cutting circulation. This is awful feeling. There's always some of those, yeah. Now it may be your finger, it may be the hand. or just like not happening, give it to a friend, okay? So everybody's a little bit different, but it is a nice tool that can be used very safely with whatever else is in your regimen and health. So acupressure rings. Meditation. So right now I should probably dim the lights, turn on some nice music, and then we're gonna meditate. We don't have time for that because we gotta do some aromatherapy. So we're just gonna move on. But meditation's big. It's been around a long time. Eastern religious and spiritual traditions in the United States, based on the NCAM data, 38 million adults. And in the last year, at least 14% meditated. Okay, so quite prevalent. It doesn't cost anything. Key thing is you want to be in a quiet location, purposeful, really engaged in that activity. You also want to have a comfortable posture. Now, you don't have to necessarily sit, cross your legs, cross your fingers, be outside. You could also be laying down when you meditate. You could be walking, or you could be standing. So really any kind of comfortable posture, focus on the activity at hand, and be open to see what you receive. Now, you cannot do meditation once and be an expert, but anytime you try is better than not, and hopefully can manage some of that stress. So it's a constant practice. What we do see is if you do meditate frequently, you are more calm, you're more relaxed, you have a more physiological balance, you could deal with illness a little bit better, have overall wellness, and an overall health and well-being. So I didn't dim and turn on the music, so we're gonna do chocolate meditation. I did not include chocolate with nuts. Let's get real, everybody's allergic to something. So we have some dark chocolate in your bag. You can now open it. Or actually, don't eat it yet. We're gonna walk through the process, but take it out of your baggie. For those of you in Zoom land, I hope that you do have some chocolate. I love the Dove chocolate, in particular dark chocolate, because it has a good amount of cacao, at least 60% or greater, gives us some good flavonoids, good heart health. And don't get excited, it's one square every 3 days. So don't be like popping one and say, well, Monika said I could keep eating this and I won't be stressed. And then your regular doctor says, whoo, we gotta look at your weight now, okay? One every 3 days, so might need to table it for the rest of the weekend. So we got our chocolate, right? And I love Dove because it has some inspirational quotes. So let's do this brief meditation. So you guys all been looking at it in your baggie, right? You're like, and that's why I tell you not to open it, because participants eat these chocolates and then they're like, I don't have one because they weren't ready. So you see the chocolate, dark chocolate, and I want you to carefully open up the package. Hear the crinkling. Quiet. Shh. All right. And then before you eat it, smell it. What do you smell? Is there some peppery? I don't know, nothing. I mean, you know, I'm congested. I've all snot. Yeah. What do you smell there, right? And then I want you to taste it, to texture it. Don't chomp and swallow, right? Like Halloween candy. Actually, just enjoy it. Let it melt on your tongue and appreciate the texture. And check out the taste. All right, so that's a little bit fun, right? We just did a meditation. I told you could do it wherever. So I always like doing the chocolate meditation. So enjoy that. But again, one every 3 days, one square every 3 days. All right. All right, dietary supplements is another option. You say, okay, what can I get in those OTC aisles at the grocery store, in my pharmacy, online? What are some helpful tools? There's aisles and aisles of these supplements, and everybody claims it works. Unfortunately, there isn't many. And so we're really restricted to about 5 different supplements that may have some benefit to help with stress. So first are the B vitamins, the B complex with all the B's in it. That can help your nervous system. Rhodiola, if any of you heard of this, this is an adaptogenic herb. It kind of tones things down. It's a botanical, and it can restore your sleep at short term and help with exhaustion. Glycine is interesting. This is actually found in Buddhist medicine, found in pork, meat, dairy, and legumes. It has a calming effect and can stimulate the production of serotonin, which has some good and bad qualities. We didn't cover that particular hormone. Ashwagandha is another adaptogenic herb. It's used in Ayurvedic medicine quite often. It can reduce those cortisol levels in the morning. So like I said, a surge will release cortisol, but we're always having some baseline amount. And so this can lower where you kind of wake up from, not an incident, just your baseline. But ashwagandha, it's kind of yucky if you do the powders. So it's effective to use it in warm milk with a little bit of honey, makes it more palatable unless you're doing the pill form. And then L-theanine tea, that's what we find in black and green tea. That also has some relaxation. Now, I'm not suggesting everybody go home and buy these 5 and do them. You do have to look at your allergies, your other medications, your lifestyles, but hey, it's a great self-learning. And you can also reach out. Is this good for me? So look more into it, but these are kind of the 5 that we can look into. Aromatherapy. So I love doing clip art. Students send me stuff all the time. I thought this was a pretty good one. Usually gives me a moment to drink some water. Okay. So what's aromatherapy? Well, aromatherapy is defined as therapeutic use of fragrances of essential oils to improve the whole person's mind, body, and spirit. Aromatherapy is everywhere these days, right? You see it in soaps, shampoos, even in foods. We even look at historical use of burning incense and the olfactory system of the smell that occurs. Or shoot, a bouquet of flowers, or go to a garden. All of that is the smells and the oils that come from plants. So people always say, well, why are we learning about aromatherapy? Well, they're plants. Why do we learn about drugs? Why do we learn about supplements? They all come naturally from a plant. And our aromatherapy is harvested and distilled, and we release concentrated essential oils or a byproduct of hydrosols that we use a lot in aesthetic purposes. Supplements, same thing, and we make those. Even prescriptions came from plants. Now, we probably now do them in a lab, more regulated, standardized, and such, but it all came from plants. So this is all the same kind of category. And so with aromatherapy, you can use it just for aesthetic and pleasurable purposes. It just smells great. But because it's plants and has biological actions and mechanism of action, we can use it therapeutically to treat things. So in today's case, things smell great, but I have recipes for you that are actually made to help deal with stress. So using aromatherapy will support healing and promote healthy well-being. So it can relax, reduce stress, can relieve pain, and strengthen immunity. Okay, so those were kind of those possible treatment options. But what if you're like, I really want to learn more? Where can I go? Can I see where I'm at? There are some organizations out there that are dealing with making sure that folks are resilient, are not being burned out, and dealing with the stress. So ASHP has the pharmacy workplace and well-being reporting available. That's something worth checking out more in the administrative piece. Clicky, clicky. All right, APHA does the well-being index. I personally like this and do it every month. It's free, sign up, you fill out everything where you're at. And then every month you get an update. Let's check in. How are you doing? And you can kind of see where are some trends and what can help you with that. Of course, they're gathering data. I'm sure there'll be a lot of information that they gather from everyone. ASHP, which is a pharmacy health system organization, does a lot of podcasts and literature regarding that. Another one that's worth noting is the mental health first aid. This is an evidence-based program for anyone. It doesn't have to be pharmacists, technicians, even just consumers. Your mom can go with you. And you can learn how to identify somebody in the mental health crisis or substance concerns and being able to identify, discuss, and get them to the right people to treat that. So it is another great opportunity. Check out our CE program. We have some of that here too. Okay, so in conclusion, on the presentation component, it all starts with you. Okay, you have to take care of self. You have to have self-compassion, self-care, self-healing. For a majority of you that probably flew in, right? If you listen to the lady, the stewardess, about if there's an accident and there's need for oxygen, it's going to drop down. You're going to treat yourself or use yours first before you help anyone else. So you have to fill your cup before you can be a better person, right? A better spouse, a better parent, better employee, right? You got to take care of yourself. But be mindfully present, and this is really hard. And I see that with my colleagues. If you're at work, be at work. Don't worry about what's going on at home. You're at home, be at home. Don't worry about an email or what's going on at work. Really try to be. I hope that while you're at this conference, you're here. You're accomplishing what you need. Be present. Don't multitask because then you half-ass it everywhere else. Just be present. We need to address the whole person. Again, that's where we're going. So our body, we have physical illnesses that we need to treat. Our mind, we need to deal with any mental disbalance, anxiety, depression, and any other larger conditions. Our heart, our emotional and personal connection. And this was a bigger deal that occurred after COVID, right? When there was a lot of isolation. I mean, we really needed to connect with others. There was a lot of loneliness. And unfortunately, that still continued. I'm glad we're in person. Zoomies, you might choose to Zoom because of a variety of reasons. Hopefully not with the privacy piece. But we need the connection, and we always try that. And lastly, spiritual, the soul. I'm not saying religion. It can be if that's important too, but just a kind of a spiritual component, that higher order. We can't do anything about the TSA or the almost accident or a boss, but we can do how we react. And that's something we want to keep striving for. And then lastly, as I started earlier, is what is the impact of stress? It's important that caregivers and providers are also cared for, so they don't have burnout. Because I could tell you at one point in your life, if you haven't, you will need some care. And I want my caregiver, even if it's my technician, filling my prescription and checking themselves did it right. Okay, so we want to make sure everybody is in a good place. All right, those are my references if you want to know more. And now we're going to get to the fun part. So we're going to all just come on up, stretch those legs. Come on. You're going to sanitize your hands and you grab a recipe sheet that gives us what we need. What we're going to have each of you do, I have 4 different stations on this table. They're on both sides, so we could kind of create 2 lines. And you're going to smell 3 different oils together. So each oil recipe, when we look at it, we look at an oil that has medicinal property that's a core, that treats it. We have another that harmonizes it, that really kind of supports the oil, and another that just gives it a better smell. You know, in clinic, when patients would need something like they had a cold sore and I would make an appropriate product for them, they say, God, this smells like ass. I'm like, I know, but it really works. I could get you something that smells better, but it's not going to work as much, right? So the smells itself can be pleasurable for some and not for others. It's based on our limbic system, a historical. There might be a smell from your childhood. You're like, oh, I remember like grandma, or hey, those cookies, right? They smelled so good. Granted, none of these smell like cookies, but you get the gist, right? But if you smelled like mothballs in grandma's closet, you're like, can't do pettigrain. Not at all. Not moving on. So you have to kind of see where each of you are at. Yep. So JD was asking about the acupressure finger rings. You actually want to go down the whole digit because there's different areas on the digit that tackle different points in the traditional Chinese medicine. It's not the best picture. Let me go back to it. You'll kind of see there'll be different kind of points along that. Yeah, this is a very not textbook picture. It's more of a steal grabber, but yes, it will tackle different areas. They actually can vary. They can vary. So sometimes if you don't like the feeling on one finger, feel free to do it on the other hand. Okay, so questions about aromatherapy, and I'm just talking about stress reductions. What about hairsprays, bath salts, balms, butters, salves? There's so many things we can make. What is it? Well, you know, that's a great question. That's a tough one. Lavender, people always think is a great stress reduction, hence the picture. It is not in every recipe. I tried to do a diversity of products depending, right? Got it. I can wait. Everybody's different, right? There might be an allergy, there might be an interaction, there may be a historical love or hate that really makes a difference. Hence why I gave the example of the cold sores. There are different oils that have different medicinal properties. So if I had somebody says, I need to make something for my face because I have a scar, I may use rosehip. If somebody says I have a cold sore, we're going to use tamanu. So there's all kinds of different carrier oils that have different properties. Today, I brought a jug of sesame oil. Show of hands, is anybody allergic to sesame? If you can buy DHEA as a good hormone, as a supplement, would that be a good way to go? Yes and no. It is available. The problem with supplements, they're not regulated by the United States, by the Food and Drug Administration. So there is a lot of question about the quality of supplements. Is what's in the product indeed? Did it get harvested at the right time, etc.? So there's a lot of limited information about determining which supplements are good. Let's say if we could identify a good one, there's a difference between getting an exogenous input of a supplement versus what your body endogenously naturally does. So yes and no. Yeah. Yeah, no, people always ask that. It's a good question. Finger ring and online. Oh, you did? Oh. No, I haven't. Have you had some experience with it? Good. So not necessarily. Of that. I think lemongrass might be similar. I mean, that has a little bit of that citronella-like smell rather than the wheatgrass, but I don't think it's commercially available. So there's about 3,000 different essential oils commercially available, but there could be folks that might be able to harvest, so dry that grass, distill it, which requires, that's a big process. That's complicated for sure. And then it would have a certain lifespan because you wouldn't add the preservatives. But just smelling it with the smell and then going opposite of the grass is going to release those volatile oils. And you might be able to kind of get some of that way, but not necessarily to get a bottle to put in a diffuser. That'll be tricky. I'm not familiar with the commercial product of wheatgrass, but you could definitely, I haven't seen, like I said, we learned a lot of oils. You kind of probably stick around a good 150, but yeah, there's about 3,000 different types. And then there's species that vary, different parts of the plant and so forth. Yeah, good question, good question.